Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. I'm specialized in minimal invasive procedures, mainly for eyelid and eyebrow. From here to here, I do not remove skin in any case. I developed a new technique to reposition the eyebrows in a nice position with 3 minimal incisions. You can see my website like invisible endoscopic brow lift, also like brow lift, and I developed this technique many years ago. In this way, for me, it's not necessary to reset the skin in this area, and also I developed a new technique for eyelid rejuvenation. I extremely believe that it's not necessary to set the skin for rejuvenation in this peri-orbital area, and I believe that it's impossible to rejuvenate the face if we do not rejuvenate the aging process at this moment with carbon dioxide laser. Today I'm going to talk about my personal technique. I'm going to talk about how avoid complications. Patient sent me these pictures from Australia before the pandemic, and we arranged an operation in BS where I work. Here this patient, we can see a little flaccidity of the upper eyelid, also ptosis the eyebrow. This patient dissimulated the ptosis with an epilation of the tail, but all this is the skin of the eyebrow. This is lower eyelid fat pads. Here we can see a little flaccidity, the lower eyelid fat pads, and here is more important the lower eyelid fat pads. And this patient sent me pictures in 2023, and this patient was operated in Australia with the conventional eyelid procedures, and this patient the surgeon resect the skin of the upper eyelid and also the eyebrow. When this procedure is done, the patient acquires this sad, tired and old expression because they eliminate the fold, but also they track down the eyebrow. In the lower eyelid, we can see an ectropion produce the skin resection in this area. The patient sent me pictures immediately after the procedure, asked me for help, but at this moment we must wait several months or more than 1 year to perform a reconstructive surgery. This is another patient that was operated outside, and this patient the same have a sad and tired expression for the excessive resection of the eyebrow. In the lower eyelid we can see the same problem, but less important is the exposition of the eye. Also you can see this redness before the exposition to the sun, the wind, and you can see in a closer view. The surgeon trying to remove this fold with this skin resection. Many patients are happy with the procedure, because they don't understand that with this procedure the surgeon removes this fold but pull down the eyebrow and acquire a sad entire look like you can see here. I get this picture from internet like an incredible result, a wonderful result. But you also can see the exposition of the eye and the sad entire expression. You can see how the tail of the eyebrow is lowered immediately after the procedure. The conventional eyelid surgery do not change since 400 years ago, but now you look for internet and you are going to see a lot of advertising that laser blepharoplasty. But this is a bluff, just for marketing. It's worse to perform this laser blepharoplasty because it's the same that this, but resect the skin with laser, and this skin have worse healing for the burning of the skin. We're going to have this scar, this scar, this is the same. Laser blepharoplasty, this scar in the lower eyelid is the same. You can see the Mayo Clinic today, they perform the same procedure. I'm plastic surgeon, professor, ex-chief of plastic surgery, director, and also have international recognition for my peers for this kind of development. Here you can see how I remove the upper eyelid fat pad through a stab incision and how I tighten and improving the skin. The aging process is not only in the eyelid or the eyebrow. The aging process is everywhere in the face, and the patients are happy to have a full rejuvenation instead of just a little bit here. I developed a new technique that instead of removing a lot of skin in this area, leaving an extensive scar, I perform 3 minimal incisions, and with 3 minimal incisions I produce a reposition of the frontal and eyebrow area. You can see how work the laser, how this patient have no flaccidity, and the expression of the eyes is completely different. We must to think not a resection of the fold, we must to think and improving the expression of the patient without removing it. Here you have another patient that have a brow lift and eyelid procedure. Here is a lateral view that where we can see the rejuvenation of the lower eyelid and the reposition of the eyebrow. We can see without laser we can have a full rejuvenation. It's impossible with a small incision here to rejuvenate all the periodical area of the skin. You must to ask your surgeon if they use carbon dioxide laser to rejuvenate the area. I think the only way to rejuvenate the eyelid and the face is with carbon dioxide laser. I hope you enjoyed this presentation.